start. So let's say the scenario reads, Mr. X was brought into the medical ward after sustaining a wound on the right thigh. Thus, perform suturing in 5 minutes to close up the exposed wound. So immediately you read the scenario, as usual, you get your sanitizer and sanitize. And then you go to the patient to get permission. So good evening, Mr. X. I'm student number 123. I've been assigned to perform suturing on your left thigh so that we can close up the wound and also to prevent infections. Can I go ahead? Anything I can do for you around here before I proceed? Thank you. I'll be back to do the procedure. After permission, you get your sanitizer again, you sanitize. You remember the procedure man says wash hands before you go to the patient and wash hands after you are done with the patient. So, but for us, we are using sanitizer. During GNC, we will give you, but it's best you go with your own because it will be somewhere where the examiner is. Meaning after permission, you rush there, you sanitize them, you come back, it will finish your time. So after permission, the next step always for any sterile procedure is the assessment. So when you go to assess the patient, you need to go in the examination gloves. So you need to don in the examination gloves, and then you only go to assess the patient. As you go to assess the patient, you need to carry the draw sheet as well as the Macintosh. But during OSP, you may find the incontinent sheet. It is something which is already made. It's just one thing. This side it has like a tent. This side it has something like linen. So you get the same Macintosh and draw sheet. You go to the patient and say, Mr. X, I'm back. I just want to place the Macintosh and draw sheet for comfort as well as to prevent soiling. I've screened to ensure privacy. And then if there's any goes on the wound, you can remove it and say, okay, the wound is not bleeding that much and it doesn't look infected. Okay, Mr. X, I'll be back to do the procedure. Let me just prepare the instruments that I'm supposed to use. After permission, remove the examination gloves and get the sanitizer, sanitize. So I have gotten permission, I have assessed my patient. The third thing is to prepare what I need to use. So on preparation, if you look at this procedure, the only thing I'm doing is to pour the normal saline on top because the rest has already been done for me, and this is the stage where you find your station at. Suturing is known as a non-touch sterile procedure, so there will be no sterile gloves which will be given because they want to see how you are using the forceps. So the only thing I will do is I'll get, this is normal saline expiring on 11 December 2024. It's potent for use, and you pour away from there. Not away but you're pouring from here, or away but you're pouring like that. The label shouldn't face the field, but it should face away from the field like that. Then apart from that, you need 0.5% chlorine for immediate decontamination. So on one of the receivers, you're going to pour 0.5% chlorine. But during your final GNC exam, we may make things easy where we'll put a bucket here labeled 0.5% chlorine, meaning things are easy. You just drop your instruments there will be no water. It will just be a bucket labeled, meaning they have already done it for you. But if there's nothing, you will say this is 0.5% chlorine for immediate decontamination of instruments, expiring in 2024, and it's potent for use, and pour it on one of the receiver. So at this point, I have everything that I need to do this procedure, meaning I'm ready to scrub. So no wristwatches. If your lab coat is long, you need to pour it all the way below your elbows. There's nothing like a zooming. No, even me, I will zoom the marks as I give you. Like your seniors, because I was on the station, they reached the station, they saying, Okay, so I'll assume I'll forward. Now, continue assuming. Me, I'm not like I know you, I'll give you marks. No, you assumed, I also assume the marks. I would think I gave you 20 minutes, I'll give you 10. So please, do the right thing, especially where I am. But if you contaminate, I'll give you marks if I see there's confidence. Because I know it's your future as well. But then I want to give you marks for not doing anything. So get your sanitizer, sanitize. Then show how to scrub. Be fast and all the way to the elbows. At this point, don't be too casual where you drop the hands like that. You have already contaminated because your hands at this point should not go below your waist or above your head because this is contamination. So they should just stay within your chest region. And then get the flannel and dry the hands. So one corner will dry the palm like that. You hold. You get the second corner, it dries the back of your hand all the way to the elbow. Get the third corner, dries the other palm like that. And get the fourth corner, it dries the back of your hand all the way to the elbow. You hold on the middle and discard the flannel. So at this point, the first thing that you do, pick the artery forceps and the dissecting forceps and the artery forceps. So if you are left-handed, put the artery forceps on your left hand because you are left-handed. But most of you have difficulties using this forceps on your left hand because you are not used. That's why I've always said, let this be on your dominant hand. Because this is the working forceps, this is just the picking forceps. That's why it's always on your left hand. So you needed to pick them. Make sure you pick, get the suture and you pin it to one of these forceps. And you are going to do this with the forceps. So even with that epidexis you are shaking, make sure you don't drop this but open it and make sure you put it somewhere. Not you hold with the hands that you know if you are in shoe. There's nothing like that for us. And clamp the suture properly, and you're not supposed to use this one is true. Once you clamp it like that, then you can place the suture here or even here, it's fine. Then from there, pick the second artery forceps, pass it here. You are still sterile, have not moved away from the field. And then prepare at least 3 swabs just for cleaning of the wound. Just 3 swabs. Remember, wound care you use 5 swabs. For this one, just prepare 3 because you're not doing wound care but you're doing suturing. So prepare 3 by dipping them in the normal swab. So after preparing the 3 swabs, then we are ready now to give. Remember I said it's wound care, then after wound care you do what? You suture. So as you start the wound care, get now the drape because now you are ready to move to the patient. So just pick 2 corners and lift it like that and you open up. Don't lift and you start shaking like that. You don't shake sterile things, meaning you have contaminated. Then just come here and drop it on the patient like that. And then if you need to position it nice, you can still move it. But make sure this hand should never come back to the field. So at this point, do wound care, get the first swab, pass it on, and wipe the furthest edge of the wound, discard it, get the second swab, wipe the closest edge of the wound, discard it, and throwing, there's nothing like this because you go below your waist. So you throw without the hand going below the waist. Then get the third swab and then wipe the needle of the wound and then discard. So at this particular point, this forceps is now ready to be discarded. So you will throw it in the receiver that you had poured chlorine in. Again, most of you are too casual. You even come like this, like you are performing a procedure on your boyfriend or someone who is proposing to you. No. Just mind your business. So at this point now, you are ready to give the lignocaine. So you are going to drop the dissecting forceps like that, and then pick the lignocaine. So hold the needle this side, like the way I'm holding it. Then pass it on to this hand like that, and this hand removes, you discard. This hand, don't drop it, leave it like this, because immediately you drop it, you have contaminated. And you are going to inject the lignofen with one hand. So you will start from the edge on top like that. Once you go in, as you withdraw, you are pushing in the lignofen. And once it's out, you go in the side. As you are pushing out, you are pushing in the drag. You go to the other side. As you are removing, you are pushing in the drag until you are able to give the whole wound. So once you give everything, then this will go straight into the sharp C box, which will be tied just somewhere here. So you drop it into the sharp C box. So for now, I'll throw it there. So I said it's a wound care injection giving the knee suturing. So at this point, I've cleaned my wound. I've given the lignofen, meaning I'm now ready to suture. So you are going to pick this dissecting forceps that you dropped and use it to pick this forceps with the suture. So you see now why we had to place the suture in advance. Yes. Because at this point, this hand moved away from the field. So there's no way, it will be impossible for me to put them together because I can't do it with one hand. So just pick this and pass it on to this hand like that. Then you are also going to pick the scissors. So let's imagine this is the scissors now remaining here. So you are also going to pick the scissors like that and drop it on the drape like this, because at this point both my hands have now moved away from the field, meaning I can't go back. So you will now start suturing. So you will hold one edge like that, puncture the edge of the wound, and then with this forceps you are going to this side, except so you are going to once you remain with just a small string, you will go in behind like that twice. Then you pull this one. Then you stretch like that. Then you do it twice like this. So once you do it twice, then the knot is now tight. So you are going to put this forceps down, get the scissors, you are going to cut this one here. After cutting, again you get the same after forceps and position your needle nicely. And position your needle nicely, again you go back on the wood and make another knot. But you'll find that mostly during your exam, immediately you make one knot, the examiner will say, give IEC, because you'll find that by the time you're reaching here, you're only remaining with seconds. So immediately they say, give IEC, just cut and remove everything. So you start now, you remove everything and say, thank you so much, Mr. X, for allowing me to do the procedure. I'm done performing, so you get these forceps, you're going to drop them here. All these forceps, you're going to drop them in 0.5%. Thank you so much, Mr. X, for allowing me to do the procedure. I'm done suturing, and this is going to promote healing of your wound and also minimize infection levels. Apart from that, I will encourage you to eat foods rich in proteins, vitamins, and minerals to promote healing. Do not apply any herbs on your wound. Make sure you cover your wound, and also ensure that you come back to this facility after 7 days for suture removal. Thank you so much. We'll see you next time. You even get your sanitizer sanitized and say I'll document and report to the ward.